Madam Speaker, members of the board, esteemed delegates, colleagues, and friends, it is an honor to stand before you tonight as the new CEO of the American Medical Association. I'm humbled and energized by the work we do together. We often talk about the AMA as one big family, and on nights like this, we see why. So thank you for welcoming me into your family. And thank you for your calls, your texts, and all the notes of encouragement. It has meant so much to me and my family, who is here with me tonight. My wife, Elisa, and our two boys, Luke and Jack. Because none of us could do this without the support of a loving family. And I know we're in DC-ish, but Luke is a rabid Eagles fan. I'm not sure where Pennsylvania is out there. I'm not sure if there's any other type. Go Birds. And Jack is ready for anyone who wants a tennis match while you're here to show off his very good backhand. And if you note it, when they showed them, yes, Luke has a Diamond Club Ampac pin. So John Poole gets to everyone right away, no matter the age. So Ampac. But we gather tonight at one of the most consequential times for healthcare in America. You, the House of Delegates, play a pivotal role in this seminal period. You are the voice of our profession. In every motion passed, in every policy debated, you carry forward not just the concerns of the today, but the legacy of medicine itself. So tonight, in my first address as CEO, I want to talk about something that we all care deeply about: the future of the AMA. The AMA has never been static. Since 1847, we've evolved with the science, with society, and with the profession. From establishing the first code of medical ethics to our unrelenting fight for access to care, we have always stood on the front lines of change. But history is not enough. Legacy alone doesn't protect patients, doesn't support physicians, or address burnout. That takes vision. That takes action. So let me be clear. The future of the AMA is not something we wait for. It's something we shape with urgency and unity. And at the heart of our work is you, the physicians. Our surveys show it. Your testimonies affirm it. The practice of medicine today is tougher than ever. Administrative burdens continue to climb. Burnout remains dangerously high. And new challenges, from workforce shortages to the explosion of generative AI, are reshaping how we practice care. But here's the good news. We're not bystanders. We're architects. That's why I'm strengthening our advocacy strategies to cut red tape and restore autonomy. We're pushing back on excessive prior authorization, fighting for fair Medicare reimbursement, and investing in physician well-being, not as an afterthought, but as a moral and strategic priority. Because the future of the AMA must put physicians first, not just in rhetoric, but in real results. In a time when misinformation spreads faster than truth and science is often politicized, the AMA must remain a beacon of evidence integrity, and trust. We're elevating science-based policy. We're supporting public health messaging. And I'm sure, as Bobby alluded to, you've all seen numerous statements that we've issued and an ambitious social media strategy, all backed by action. And we're fiercely defending the physician-patient relationship from interference, whether it comes from politics, algorithms, or bureaucracy. Because this is not just about facts, it's about trusts. And in the noise of a fractured information landscape, our voice, your voice, must be clearer than ever. Now, some of you that know me know I've always been a lover of history, so it's great to work at a place that's over 170 years old. And to put that into context, when you come to the Chicago office, you can visit our archives. And on the 47th floor is a display showing how the AMA fought medical quackery in the early 20th century. The numerous potions and concoctions that promised to cure disease and prolong life. And what we did is we led by focusing on science and encouraging the patient to talk to their doctor and trust their doctor. Well, what's old is new again, because that's what we're doing right now. The future of the AMA depends on our credibility. And credibility is earned every day, in every word, in every stand we take. And that's why I'm also delighted to have announced just yesterday the AMA's new Community Health Impact Lab grants. Shorthand, we call it CHILL. And our goal for CHILL is simple, but it's ambitious. Invest in physician-led, community-centered projects that improve health outcomes among populations, particularly those that are marginalized or disadvantaged. The program is about innovative solutions led by those who know their communities best, doctors on the front lines. You want to solve the problems of healthcare? Let physicians do their job. Let us be unencumbered by excessive regulation and administrative burden. We can solve the problems of healthcare since we're the ones who know it the best. And our vision is a health system that's inclusive, that's just, and grounded in our oath to serve all. Now, technology is changing our world. AI diagnostics, wearables, virtual care, these are not science fiction. They're here now, and they're powerful, but they're not without risk. Our AMA believes technology should extend the human touch, not replace it. We believe in guardrails, not blind adoption. And we're leading national efforts to shape ethical standards for AI in healthcare. Because innovation without humanity is not progress, it's peril. And that's why I was proud to announce the creation of the AMA Center for Digital Health and AI, putting physicians at the center of shaping, guiding, and implementing transformative technologies. As Bobby pointed out, physicians must be leaders in AI because we understand the needs of patients better than anyone. We know what works and what doesn't work. We must lead the conversations about AI policy and regulation, workforce integration, education, and training. And we must do this as one medical community, one family, so that we can unlock the extraordinary potential of this technology. Now, the future of the AMA must be both visionary and vigilant. And across medical schools and residency programs, I see a new generation of physicians, and I'm sure you do too. Smart, passionate, diverse, and deeply driven by mission. But many of them are asking hard questions. Does the AMA speak for me? Does organized medicine reflect my values? Is this a place where I belong? And let me say without equivocation, yes. The answer is yes, and yes, it must be. If we're to remain the unified voice of medicine, we must listen deeply, adapt courageously, and welcome broadly. We must work together, because truly together, we have more power. The future of the AMA must belong to the next generation, not just as members, but as leaders. Over the next few days, we won't always agree. We come from different specialties, different practice settings, different ideologies. And yet in this house, this unique, powerful house, we come together for something bigger than ourselves. We're not just protecting a profession. We're protecting the sacred bond between doctor and patient. We are truly guarding the soul of medicine. And we do that better together. Because the future of the AMA, and I would argue the future of medicine itself, depends on our unity of purpose. So where do we go from here? We keep fighting. We keep evolving. We keep leading. We strive for impact in our relentless pursuit of a healthier America. We speak with moral clarity. We act with strategic strength. And we honor our past by building our future. And we do it together, each step of the way. Because this is our calling, this is our charge, this is the future of our AMA. Thank you.